This is Jim Zuckerman. Jim has wanted better looking teeth. He's had some failing teeth from periodontal disease. Now, during the course of this treatment, Mr. Zuckerman has expressed a desire to have a better smile and just some improved teeth. He is a photographer and does a lot of speaking engagements, does a lot of traveling, and would like to he's always questioned why his teeth are the way they are and would like to improve it.
Well, for a long time, I've been uncomfortable about these teeth. And when I was younger, they weren't like this, but I guess they've migrated, and over time, a couple of times it was pointed out to me that these teeth were obviously skewed, and ever since then it's been in my mind, and it's inhibiting to smile. You feel really self-conscious, and it's just a real unattractive look.
So I sent his models and his information to a lab technician who has put it on a articulator, and we can see here that Jim has got some malocclusion. In other words, his teeth are crooked. You can tell that Mr. Zuckerman has a lot of wear on his front teeth, and his lower teeth, you can tell, also are crowded and have those divots on the front teeth, which is very indicative of the wear that he's experienced. So the lab technician has taken this information with a lot of other information, photographs, x-rays, some feedback from myself on what I would like to see happen and what our general plan is with Mr. Zuckerman. And with that information have done this diagnostic wax-up of him, giving him an ideal bite and also giving him a lot more tooth structure that is showing. So this should hopefully give Mr. Zuckerman better function. He is going to be sedated today. His wife is bringing him. It is going to be a long procedure, and anytime we do a lengthy procedure like this, it's good to have a patient sedated. They just do much better, and we just take our time with them. You know, if I don't get to do all the work that we had planned that day, that's okay. It's still a success because we've made it through that day with the goal of making that patient comfortable and making them feel like at least next time they can do this and it's going to be okay. So that is our goal, to provide him with not only a great look and great aesthetics, something that he can smile with pride at, but also so that he can function and protect his teeth. Today, I will use this as a form to make his temporary so that when he leaves here, he is going to go from a transition from this to this. He'll wear those for a couple weeks. We'll bring him back. And with everything going as planned, we'll put new restorations in. And then over the next several months, we'll get those posterior areas finished. And hopefully by the first of the year, he'll have some great new teeth. Right now, I just want to see what shade parameters I want to go within for Jim's facial tones, his pre-existing color of his teeth, maybe some of the pre-existing crowns that he has. I'm leaning with this 030, and for Jim, I think a more natural look. Go into a little bit of a deeper shade on the canine and have some graduation of shade instead of one big block of white, which is what a lot of patients end up with. And for my patients who want to look natural, that's not something they want. They don't want to have their teeth enter the room before they do, or have somebody say, oh, you have a pretty set of crowns, or I can tell you got your teeth done. We want them just to notice that they look better, that they're improved, but not really tell what the patient had done. And then this will be something that we strive for. Yeah, it's a huge difference, but what's really nice is that you can make that difference look so natural. This device here was made off of his wax up, and now we've filled that with material and we're holding it over his teeth so that now his temporaries will be made off of will be made like his wax up was, so that we can have a transition of where we're going. And like I said, we prepped only not just a few teeth, but 8 teeth today. And then because this is Jim's first sedation appointment, we don't want to push him too hard, and we can bring him back to do the lowers and the back side here. Then we also need time to place some implants over here and keep going from there. But he's done really, really well today. Everything's gone just actually better than I anticipated. The previous crowns that we took off, he had some decay up underneath there, a little bit of decay around the margins, but nothing that ended up needing root canals or anything of that nature. He's, you know, as you can see, he's done really well through the procedure, slept through most of it every now and then. And patients are asleep. You can see him trying to curl up here, so that's their, you know, usually how they sleep is how they behave in the chair. And he'll get a great day's rest out of this. Now it's just a matter of making him pretty since we got his bite right. And the way it is, remember. Now you can floss between them and they're nice and smooth.
God, that's amazing. This lip feels so weird. That is absolutely incredible.
Isn't that cool?
Yeah.
I mean, it's like you grew up with them.
Too pretty?
Yeah. No, really, it's amazing.
It is. They're awesome.
Yeah.
Is it what you expected?
Well, to be honest, I didn't have an expectation. So, I guess if I would have expected something, these are better. I've not had teeth that white for decades, and they're perfectly even. And also, Dr. Foley told me that I had ground my teeth over years, that they used to be bigger when I was younger. And so now these are like a normal size for my face. So it just looks a lot more natural. I've seen other people have nice teeth, but I'm not so used to not having it. I'm not used to seeing it in my face.
Mm-hmm.
And it's really better than I expected. I haven't seen teeth this white in my face for a long time, 30, 40 years.
Mm-hmm.
And I was never really aware that my teeth were smaller than they should have been until you mentioned it. Mm-hmm. Then when you did, I saw that they were. And now these are more fit for my face.